All right. Okay, so it seems as though folks kind of came in quite quickly, so I'm going to go ahead and get started. And we are just so lucky tonight to have a wonderful guest speaker, and we are also lucky to have such a large crowd tonight. So we're glad you're here. So welcome to the Center for the Business of Health Career Network's Fireside Chat. We are so excited to have Dave Kim, CEO of Compass Health Advisors, here with us tonight, who will discuss his educational and career path, but will also share his expertise in healthcare consulting and structured thinking. Some of the things that might be of interest is definitely to many of our students, but many of our partners and pivoters. Thank you for joining us. The Fireside Chat is a part of the UNC Center for the Business of Health's Career Networks program. Career Networks is a constellation of resources meant to educate and create community around the continuously evolving healthcare ecosystem. You can explore the CBOH Career Networks platform via the URL I'm pasting right now in the chat. And for tonight's chat, we ask that you turn your video on and mute your microphone while not asking questions. The format of tonight's session will be a presentation by our guest, followed by Q&A and a discussion with the audience. If you have questions during any part of the presentation, please raise your digital hand and we will allow you to chime in. Also, we sometimes have folks that are in the clinic or in places where they can't turn their camera on, and if you have a question, we'll try to monitor the chat, but we have a lot of folks here tonight, so we'll do the best we can. So again, I'm not going to delay, so let's get started, and I'm going to turn it over to Dave Kim. Welcome.
Thanks, Suzanne. Can you hear me okay? Okay. Well, thank you everyone for joining this Fireside Chat. I'm really excited to be here and talk a little bit about my career journey, as well as the work we do at Compass Health Advisors, as well as just consulting and some perspectives on that in general. So without further ado, let me go through a quick agenda. I'll just start off by talking a little bit around my journey, kind of my background, talk about why I've been in consulting for most of my career, as well as healthcare consulting. And big part of that story is Compass Health Advisors, a little bit more about kind of some of the entrepreneurship and some of the decisions that went into starting Compass. Again, some perspectives on consulting in general. One of the topics is around structured thinking and consulting. So I'll talk a little bit about that, meaning what it is, why we do it, how we do it, and then again we'll end with some Q&A. But like Suzanne said, if you guys have any questions, feel free to jump in and interrupt me. I am a consultant, so I have a good number of slides that we'll go through. But again, please feel free to jump in. Again, this is a fireside chat, so we should view it as something a little bit more intimate. So just very quickly, my career, starting from undergrad, I'm originally from New York State, grew up on Long Island. If anyone is from the New York area, I went to school upstate and got my undergraduate degree actually in government, and I was pre-med. So two things that eventually merged into healthcare. So I got my undergraduate degree up in Ithaca, New York. Then I moved down to New York City, and I worked for a health plan startup for several years, and then quickly moved into consulting. Kind of got the bug, and worked at Deloitte Consulting for several years. I took a quick pit stop and got my MBA up in New York as well. And then I worked for about 10 plus years for various, I would say, mid-sized consulting firms. Kurt Salmon, which was eventually acquired by ECG. I worked for another mid-sized, more healthcare IT-focused firm, Encore Health Resources. And then it was in 2016 almost 10 years when I started Compass Health Advisors. So that's just a quick flyover of kind of my journey. I think an important question that you may have that I've also been mulling over in preparing for this is, why consulting? I've been in consulting for 20 plus years now. And so, the reasons I tried to summarize, there are many reasons why I think consulting is great. And so as I think about my journey, when I first started and up to now, these are the things that I've kind of distilled down into what I feel like are some of the key aspects of why I've been a consultant for so long. So one is just the development of skills and how that's accelerated in consulting, in my opinion. So understanding how to think analytically, financial modeling, presentation skills, all of those which are kind of broadly transferable to many other aspects of your career is something that's been highly impactful. Thinking about exposure to really high impact work, so working on strategic challenges with our clients, kind of gaining expertise to client management, leadership opportunities early on in your career is also something that was great and has been great. Consulting is intellectually rewarding. It's a career where you're continuously learning on multiple diverse projects across different clients, working with different client stakeholders. So really trying to stay and forcing you to stay at the forefront of innovation and best practices. It's also a pathway to entrepreneurship in many ways, and I'll talk about that because that's part of my journey. And then just from a personal perspective, I think the ability to be in these environments where maybe high pressure, some of the situations and engagements are somewhat ambiguous, as are the client environments. Those are all wonderful things that help build your confidence, resilience, and adaptability, again, which is just part of one's personal growth as well. So that's consulting. When we think about healthcare and why healthcare is such an important part of my journey, I mentioned earlier, I was government. I studied a lot of health policy back then. I'm dating myself. This was in the early 90s. There was a lot of healthcare reform during the Clinton administration with managed care. So a lot of health policy study along with my pre-med background that really kind of had me gravitate towards healthcare. And, as I learned more about it and learned about it over the years, there's this idea, like if you think about math and you think about kind of revenue, you think about expense and the financial side of things, the math of healthcare is not changing anytime soon. So I'm sure some of you or most of you know, well, I won't assume that, but as it relates to just some of these numbers in healthcare and where our country is and the amount that we spend per capita in relation to other wealthy countries, it's nearly double. Yet our outcomes are no better or actually much worse than our peers. I know the type is small, I apologize, but if you see of these 6 outcome measures, of the 4, there are 4 where we are the worst in relation to some of our peers. So those 2 things don't align well, and that's a problem. So that on top of, there's a lot of, this has been around for a while. I know as it relates to recent events in terms of waste at the government level, I think healthcare overall, there's general consensus that there is a significant amount of waste, and that's been estimated to be about 25% in terms of spend that's unnecessary, ineffective, maybe overpriced and or wasteful. So that is all part of this math problem, which is a big challenge and problem to solve. So it makes healthcare interesting. There's also this idea of the social drivers of health. There's been a lot of research around this, and a lot of activity here in North Carolina, as well as many other states, that are thinking about how to um, address the life conditions in which people are born, in which they grow, live, work, and age. And there's been research done to say that really, what drives health is are all of these other things. 20% is really for medical care, but when you think about your physical environment, whether that's air, water quality, housing, transit, your health behaviors, or socioeconomic factors, that accounts for the other 80%. So how we solve that problem again is a major issue. It's something that is continuing to be kind of looked at the federal and state level. There's been innovation around there having to do with population health management, value-based care, which we can talk about in a little bit. Then there is this broader macro trend in our industry where the entire healthcare system in our country is being transformed. And this is around this notion of the payment mechanism. So there's, to try to boil it down, it's a shift from volume to value. And so what that means is, this timeline illustrates, generally speaking, this idea of moving from a system where there's rising kind of uncontrolled costs because of this system where you're just paying for volume. So whatever you do, it's the quantity that drives the reimbursement, not necessarily the quality of care. So that has been something over the past 20, 30 years that's continued to evolve. A major inflection point was in 2010 with the Affordable Care Act, where there was this shift from fee-for-service, fee-for-volume to value-based payment. And that was driven from a regulatory perspective to start to create organizations like ACOs and accountable care organizations. And so this idea of thinking about how to reimburse for healthcare differently has been this gradual shift over time. And so I would say over the past 10 years, and this again, we'll get into kind of the origin story for Compass, which I started in 2016, where now there's this accountability. Providers and payers are working more closely together to think about how to coordinate care, how to think about improving outcomes and quality. And a big component of this has been leveraging IT, which I'm sure we'll probably speak about at some point today as well. Okay, I will keep going if no one has any comments or questions. So I did want to segue a bit into Compass Health Advisors, and that's partly driven by what we just spoke about. I started Compass in 2016 with the goal to focus more in this space around alternative payment models, value-based care, and population health management. My career in consulting has always been in healthcare, but focusing it in this space was what I wanted to do. I think there's this idea of the old hockey analogy of not going to the puck, but headed to going to where the puck is headed. And I think that's apropos here in terms of where the industry is. So our mission really is built upon three pillars: population health management being one, whole person healthcare, thinking about those social drivers of health that I mentioned earlier, thinking about this 360-degree view of a patient, not only their medical conditions, but what are their needs from a behavioral health perspective, their socioeconomic status, all of those things that go into describing the whole person. And then digital health enablement. Again, the technology component is such an important part of enabling, connecting all of these entities, all of these systems, and sharing that data across both clinical, community-based providers is a key, is a critical success factor for kind of making this all work. So Just very quickly on population health management, I won't read that long technical definition, but if you think about, I view this as our North Star, population health management, and something called the quintuple aim. This has evolved over the years. It's this framework to think about what are the goals of population health management. It was originally the triple aim, I think, and then became the quadruple aim, is now the quintuple aim. So these goals of, maximizing patient experience, getting access to care, care that's patient-centered, looking at better outcomes and functional status, reducing disease burden, health equity, those social drivers of health. One of the recent additions to the aims has been the care team experience, and not only the patient and making sure that they are being kind of cared for, but the care team as well, and making sure that that they're not getting burned out as well, and overburdened and getting taxed with a lot of the resource and capacity constraints of our current healthcare system. And then of course there's cost. So thinking about how do you reduce cost while improving these other things. So that's just very quickly population health management. I think this was a question, probably maybe a question on your minds as it relates to consulting, kind of why start Compass Health Advisors. I think I've explained that to a certain degree as it relates to kind of where the industry is heading. I think the other perspective I wanted to share was the benefits that I described earlier. So accelerated skill development, intellectually rewarding, personal growth. That I think helped to establish a solid foundation. But this pathway to entrepreneurship, I think as you continue to evolve in your career, accumulate knowledge and experience, you want to be able to leverage that. So how do you kind of integrate that expertise and insights you gain at larger firms with the personal vision and goals that I had for myself? So some of the things that I feel moving into starting your own firm, maybe even just starting your own company, are being able to focus and focus more deeply on a certain subject matter versus just being kind of more broadly focused on strategy. Really being able to establish yourself as a thought leader. As it relates to client relationships, being able to build deeper kind of long-term relationships with your clients. There is, with the smaller firm, there's less bureaucracy. There's just more ability to kind of make decisions, as well as kind of greater autonomy. I think that goes hand in hand with it. So being able to choose the types of engagements, the type of clients that you work with that align with kind of your goals, your passion, your values, I think are important, as well as how quickly you want to grow. The pace and the scale of growing. I think that largely depends on kind of the leadership of the firm and how you want to go about that. Oops. So that's another important piece. And then, of course, I think making a difference in the area that you want to make a difference. So for me, improving healthcare for populations, that's always been one of my goals and outlooks, is to think about healthcare, there's medicine, and being able to really impact an individual patient, with a nurse or doctor, a patient relationship, but thinking about population health and improving the health of a broader population, developing and implementing sustainable solutions for long-term success and health outcomes is something that really drives me and I'm passionate about. Okay, I have another pause here. If there are no questions, I'm going to keep on going. So wanted to just provide some perspectives on consulting in general. Consulting is a very large sector, right? There's lots of different types of firms, there's different types of services, there's strategy, there's IT, there's boutique, there's big four, there's international, kind of US focused. So, I thought the I thought a good way to describe consulting is through the types of engagements, and I think this is helpful because this characterizes projects. It also characterizes um, certain firms and where they specialize and focus in. Um, we actually, even though we're a smaller firm, we do work in all of these areas. So I'll just go through them, but they represent this end-to-end process of working with clients and trying to drive meaningful change. So on the front end, there's planning and advisory work where you're assessing, you're analyzing data for a particular problem, you're diagnosing those problems, identifying improvement opportunities, and developing recommendations. Again,
Oh,
that's
uh,
We have a
busy.
quick question. Could I
We
interrupt
yeah,
stayed
just for a
the whole
second?
time.
And I'm trying to mute one of our folks as well. So if you have your camera on and you're talking behind, yeah, thank you. All right. We have Ladarius that has a quick question. Would that be okay to entertain that right now?
totally fine. Yes, absolutely.
Awesome.
Yeah, there's.
Hi, sorry, tried to get the reaction up. My question was just about earlier, you were talking about your passion for improving the outcomes and how that helped lead you to start your own firm. And I wanted to know if you could touch on that a little bit more, given how trying to have a firm while also prioritizing public health and outcomes and how the difficulty of doing that and an environment where you still have to try and have a business, have a profit.
Mhm. But yeah, thanks, Ladarius. That's a great question. I mean, we are not on the front lines of care. We're working with our clients to help them do what they do better, and that could be through a combination of a new program, a new technology, a new way of doing things. Um, but I think from an outcome standpoint, I think when I think about population health management, which I described earlier, there's this rule around, 5% of the population drive 50% of the costs in healthcare. So really thinking about how to kind of focus on those folks that may need it the most and that most costly, that are driving utilization of healthcare, that might be coming into the ED, revolving in and out of the ED because of reasons out of their control, and needing to address that. I think of that on the outcome side. That's the rule and that math that I talked about earlier that I'll always go back to, is really think about how do you maximize both the client's resources as well as what they may be investing in us to help them. And it's really thinking about that percentage of the population that needs it the most. Hopefully that helps or answers your question there. Looks like we have another hand up. Sorry, I apologize. The you guys were over here on the left, but I do see another hand. I've moved you guys to front and center now.
Yeah, all good.
Aiden.
Um, so the question I had, my sister was also in healthcare consulting. This kind of ties into the previous question because sometimes she debated if she was prioritizing the business's needs over the patient's needs. And I was just wondering, I'm sure healthcare consulting is not as popular in areas where the government is more in charge of healthcare aspects and stuff like that. Is there a patient quality like benchmark that is considered in healthcare consulting?
Yeah, great question, Aiden. I would say to that last piece, yes, there are many quality measures. There are organizations that kind of develop standards for quality measures that health plans and insurers need to meet, and then those health plans that work with providers will establish contracts with those various measures, and there'll be various incentives built into those contracts so that if you're kind of meeting those benchmarks, you may achieve more of a bonus or quality payment, let's say at the end of the year. So that piece, yes, there are. I think the other part of your question around are you helping the business or the patient? I think that's a great question. And it's one that I think is, philosophically one that every healthcare consultant needs to kind of ask themselves. And I think one of the things that I've tried to do, in my journey is work with organizations that really want to make this change. I think there are organizations where they're, for various reasons, not able or as interested in kind of focusing on the things that I may want to focus on. And so to the extent I'm able to, I can't always pick and choose, but to the extent I can, I'll do that. Because I think you're right. I think there sometimes is, there are incentives, and sometimes it's not the fault of the providers or the clients. Sometimes it's just the system and the way it's set up in terms of how they're being reimbursed. So anyway, I feel like I'm rambling, so I'll stop there. Hopefully that's helpful.
And a great segue back into your next section.
Yes. Okay, so I'll just keep going. Again, keep the questions coming. They've been great so far. So planning and advisory work. So an example of that would be, assisting a hospital to decide whether they should build a new hospital, to expand in a region, or maybe expand into new specialties or create new specialties within their hospital. I'm sure some of you have seen the recent announcement of the Duke and UNC collaboration on the Children's Hospital. I am confident they had consultants help them with that decision and that analysis. So that's planning and advisory. The next type of work then moves on to, thinking about recommendations maybe that came out of some planning and advisory initiative or work and translating that into a set of, actionable solutions. So that could be designing a new process, designing more of an IT system or set of systems that work together, thinking about your organizational structure or operating model. So that's designing and building. An example of that would be designing a new care team and staffing model. That could be a new set of reporting responsibilities, new processes, those types of things, more operationally speaking. And then there's, you've designed a solution and now you have to implement it. And in consulting, there often are these dividing lines where certain firms will maybe just help plan, make recommendations, they may even help design something, but then implementation, sometimes you need a larger team, sometimes different skill sets. So this also breaks down as it relates to thinking about segmenting the consulting firm space. But implementation would be designing, executing those solutions, making sure that they're being implemented and adopted. And a good example of that in the IT space is, helping to implement the new EHR system, for example. So hopefully that is helpful, just to give everyone a quick sense, lay of the land as it relates to consulting services. The other thing that I thought would be helpful to speak to is this, dimension of, thinking about consulting as, when we think about roles and career development, there's this idea of the apprenticeship model. And I think this is a great analogy as it relates to growing in a career in consulting. There are, there's this idea of consultants learning under the guidance of, more experienced consultants. And so there's learning by doing, you're gaining skills, knowledge, gradually through, practical on-the-job experience. And then you're gaining, more responsibility as you start to kind of accomplish and master basic tasks, taking more responsibility for for more complex tasks. This model includes mentoring by more experienced professionals that can guide not only your work but your career, give you guidance and feedback as part of that learning process. And then as you start to develop skills and knowledge and start to master them, that's when you start to become more independent. And so that is a progression generally that, and a model that I think is a good way to describe a career path in consulting. These 4 levels here are generalized. I think most consulting firms will have some set of roles and titles that align to this, but starting out as an analyst, you're more focused on data collection and analysis. Then you move into a consultant role. Some of these have senior associate kind of tied to them as well. So as a consultant, you're starting to do more advanced development of insights and developing of recommendations. Then as a manager, you're managing projects, overseeing projects, and even starting to manage and work with clients more directly in some of those client relationships and business development. And then, of course, there's the partner, principal, sometimes managing director, that level where you're the leadership of the firm, you're focused on high-level strategy, thought leadership, business development. Okay, so that is my spiel on just consulting in general. My next topic is this topic of structured thinking, which I will move on to. I am speaking slowly to see if there are any questions. I don't see any hands, so I will keep going. Oh, I see a hand. Ladarius.
Just kind of touching back onto my previous question, you mentioned the wanting to work with different facilities that actually wanted to put forward effort in expanding or improving outcomes. And my question is, do you feel that there is some type of, I guess, tipping point to where these facilities will improve so much and have so much better, more outcomes and performance metrics that will incentivize other facilities to reconsider their current, I guess, model, if that consulting will really play a large part in that? And if not, do you see any other mechanism facilitating that?
Mm-hmm. Yeah. Another great question, Ladarius. I would say there are a number of incentives in place, and this goes back to this transformation that's happening around reimbursement in healthcare. And some of it is being driven by the government, like CMS and the Medicaid and Medicare programs. But there are also, on the Medicare side, there's more private payers. So there's more, I would say, in the private sector with some of the health plans and health insurers in that space. They're also driving that. So I think, when you look at the payer type, there are some differences in how quickly something like value-based care and population health management is being adopted. Some of that is based upon the amount of funding available. I think some of it is also just where some of the dollars are being invested. Like if you think about like private equity and venture capital, a lot of those dollars that have been invested, and a lot has been over the past probably decade-ish, a lot of that has gone more into kind of Medicare, into the Medicare kind of payer space. For a variety of reasons, it being more simpler. There's just one payer at the federal level. Medicaid is more complicated because there's federal and state funding. So I think it depends on the payer, and I think it's an important question that has kind of many layers to it in terms of the dollars, the payer mix, and then back to, I think, where organizations want to kind of spend their time and energy. So hopefully that's helpful or answered it at some level.
Yes, thank you.
And before we move on, I just wanted to ask Dave one more question that kind of boils down a number of questions I think students have or audience members is how do folks that might not have gone through a traditional business route, actually, Dave, it seems as though that wasn't your undergraduate degree area, or if they're in like hospital administration right now, or they're coming from the hard sciences, do you have any recommendations for these folks to kind of transition or pivot into consulting?
Mm-hmm. Yeah, it's a great question. And I'm not just saying that, I keep on saying that, but they're all great questions. And that's another good one, Suzanne. I would say um, part of it, I think, is just talking to people that are doing the work, who are um, currently in a consulting role to get a better sense of, what they're doing. I think it takes, a decent amount of conversation, and then part of it is kind of learning by doing. And so I think this next section actually will help speak to it at some level. So I think you were great in helping tee this up, because I do think it's kind of a broad kind of approach to problem solving and structured thinking that I think is an important part of any consultant's toolkit, if you will, and the way they need to approach problem solving at a macro level and a micro level. So I think for folks that aren't consultants, hopefully this would resonate. And these are the things that I think are critically important as it relates to being a consultant and being an effective consultant. So
Thank you.
yeah, yeah. I'm not punting, Suzanne. I'm saying that's a great segue. So, structured thinking, what is it? I think it's critical to being a successful consultant. I am gonna read this more technical definition because I think it's important. Um, I would say structured thinking is a systematic, logical, organized approach to problem solving, and that breaks down something that's very complex into kind of smaller, manageable components, and that's using frameworks, methodologies, different analytical tools, which we'll discuss in a moment. But just to quickly break it down, again, I think to Suzanne's question, if you think this way about any problem, whether it's personally, whether it's how to solve a problem over the weekend, how to solve a problem in your life on a macro level, I think if you think this way, I think it's a good sign that you might be interested in consulting or maybe potentially be successful in it. So just to break it down, I think there's this step, and I don't think any of this is rocket science, but you want to define what a problem is or issue is, and you want to define it clearly, comprehensively. You want to start to break that down into smaller logical components. You want to analyze these components and using various, you want to use data, you want it to be data driven, use various frameworks and logical reasoning, obviously. And then one of the key components of all of that analysis and being successful is being able to synthesize that. So taking those kind of comprehensive analyses and developing insights that can then have some actionable recommendations. And then being able to communicate those clearly to your client in a clear and compelling manner. So those are all very important steps, and there's a lot involved with each of them. And but I think these are, if I had to try to distill how I view structured thinking, this is how I think about it. And I think, especially in an industry like healthcare, it's so important because healthcare is so complex. If you think about all of the various, components and stakeholders in the value chain, whether it's payers, providers, suppliers, pharmaceuticals, you know, there's so much you need this structured thinking to help you navigate a lot of ambiguity, a lot of complexity. You really want to have rigorous analysis. You want to mitigate subjectivity as much as you can. And then this helps you build credibility, right, with your clients, with your teammates, and trust. It provides this common language to help facilitate communication and collaboration. And then it helps drive efficiency and meaningful change because it helps you prioritize, it helps you call out the things you want to focus on and the things you don't want to focus on. So again, I think structured thinking is not just a skill, but it's really the essence of what I think makes consultants valuable. So I'm not trying to overblow it, but I think I truly do believe that. So just wanted to provide a few quick case studies. Again, thinking about kind of from a healthcare perspective, what's the problem you identify? What's the framework or methodology that you're using to analyze it? Kind of what's your solution and maybe what's the outcome? So these are all healthcare related. Some of these we've been involved in, some more tangentially, but think about hospitals and readmissions. If there's a high readmission rate for, let's say, heart failure patients, using, let's say, root cause analysis to identify some of those gaps in care that might be happening once folks are post-discharge, and then implementing a program that involves patient education and follow-up protocols that could then lead to reduced readmissions. And so there are examples of this where within 6 months, readmissions have been reduced by 20%. Another would involve, kind of from an operational perspective, thinking about an OR and low utilization of those OR rooms. So that's capacity that's out there. You want to maximize it. Hospitals want to maximize that space. So how do you do that? You use tools like process mapping and workflows to identify some of those inefficiencies, redesign some scheduling processes, think about allocating staff a little bit differently, and then voila, you have increased OR utilization. Another case study from a technology standpoint is telehealth. I'm sure you guys have heard about telehealth and its ability to provide care and access to rural areas. So thinking about a particular rural area or set of rural areas and providing access, conducting a SWOT analysis to determine feasibility, then launching a platform and rolling that out, then that will help provide access to care and reduce patient travel costs. So all beneficial in terms of this whole virtual care movement that's happening in our industry. So just quickly, some best practices as we think about these engagements, this type of work. Again, from a consulting standpoint, from a structured thinking standpoint, again, I think these are all important guiding principles, best practices to think about. And I'm sure some of you have used these, are using these, starting with the end in mind. What are your objectives and metrics? From a consulting standpoint, engaging kind of your stakeholders early on projects, whether that's clinicians, administrators, staff. Leveraging data is critical, both quantitative, qualitative data that will inform decisions, drive the analysis, validate solutions. And then, these chevrons, if you will, imply this linear process, but really this is, these are processes and projects, initiatives that should be iterative. So you're kind of rolling something out and you should be continuously testing it and looking to improve and refine it. And then one more, there's obviously communication. So, like this presentation, I think the consultants sometimes get a bad rap for the number of PowerPoint slides they need to develop or they do develop. I do think presentations are important and they do need to be tailored. They need to be visual, they need to tell a story, they need to convey insights. I do think there are plenty of examples where where consultants fall short. I try to not put myself in that category, but I think communication is essential. Okay, I think this is my last slide, and I am going to be quiet and try to answer some questions. So I'll try to end on a lighter note. Back to consultants getting a bad rap. There are a lot of buzzwords and there's consulting jargon. Just even the word frameworks and methodologies, those are buzzwords. But I do think these frameworks that we rely on are important, and they do help to organize our thinking, our analysis. I'll go through this list very quickly. You are all familiar with many of these. I'm sure have used them, learned them in class. Just kind of go through this list. Value stream mapping, decision trees, Porter's 5 forces. Someone jokingly said to me once, why do we use all these tools? And he said, just, do smart things and avoid doing dumb things. He said, why can't you just do that? And I said, we can try. And we do try. But I do think there is, joking aside, I do think some of these methodologies can be, not effectively leveraged. And I think there's some issues around, being rigid and not being kind of flexible in your thinking and trying to force like a solution into one of these models without really thinking about like a particular client context. Sometimes these methodologies oversimplify the problem that may be very complex and it doesn't go deep enough. There's some time of resistance to, again, creativity, innovation, if you're trying to force this model and relying on too much. And sometimes some organizations are just not interested in your 2x2 grid. They want you to just really talk them through an issue, a solution. They don't want PowerPoints. They don't want kind of long spreadsheets of data. They just need you to really help them think through a problem and help them solve it. That being said, I do think these frameworks and methodologies are important and valuable. They do have this idea of a playbook that you can follow. There's nothing new under the sun. Their problems are not unique. Certainly there are nuances and things that might need to be customized in terms of the solution, but there are often recurring themes and common themes as you're approaching. So these methodologies help. They also help to communicate, again, very complex ideas more clearly, more simply. A lot of these methodologies, these tools off to the left, they're visual, they're easy to understand. And again, they kind of bring kind of parties together, making sure everyone's on the same page, reducing instances of miscommunication. So I think the important things are you really want to leverage these tools in a way that you're not, you're leveraging them, but you're not relying on them. And you're tailoring these frameworks and tools and methodologies to the client's unique context. I think that's important. And then I think the other key thing is just being open to kind of adjusting the tool, remaining open to different ideas when applying the tools, and even, modifying the tool itself. I would say all of these on the left, we've used it in some way, but not always exactly to the letter of the law of how they were originally developed or designed. So again, I think based upon the client's particular context or situation, there just needs to be flexibility and openness to adjust to whatever the client may need. So, okay, well, yep, that was my last slide. Well, this is actually my last slide. So thank you, everyone. Hopefully that was helpful. I know I was talking fast, but looks like we have about 10 minutes for questions, Suzanne.
This is a great time. Please speak up if you have any questions at all. Again, you have someone who's actually been in a number of different consulting capacities. So right now, I'm opening it up to the crowd. Again, raising your digital hand helps the most. And don't be shy. This is a great way to start the conversation.
I can just take it as if I was very thorough, then maybe is
There you.
how I should interpret the no questions.
Okay, we have Ladarius with a
Hey,
question.
there's
I was just want to, I guess, like Suzanne said, since you're here, it's kind of a simple question, and you touched on it a little bit, but if you could talk more about that um, kind of baseline that consulting gives you to be able to move through certain roles more. For instance, I'm a military vet. I was a lab tech for 10 years, and I'm more interested in being able to transition to the biotech side of things. And I just want to know if you could speak more about how consulting can prepare you to, or prepare you to jump into those roles.
yeah, I think consulting is a great launching pad for a lot of different paths. If like I have done, I've stayed in consulting, but have worked for different types of firms that are more focused on, always in healthcare, but firms that have been more focused on technology. Sometimes it's technology strategy. I worked for a group that was just focused more on healthcare IT strategy. Um, and then what I'm doing now is a little bit broader. So I think those, the structured thinking that I described earlier, and then some of those elements of going back to this slide, um, you really do get um, a quick and kind of wide exposure to um, developing a lot of skills, whether it's analytical skills, maybe financial modeling skills, developing kind of effective presentations, presenting those. I think those are all important parts of learning and growing. And that also includes, working on multiple projects, working with different clients on different types of projects, looking to solve, answer different types of questions and solve different problems. Um, I think those are all things that consulting provides you with pretty uniquely, um, just because of the nature of project work and working with different clients and working with different people at different clients at different levels and on different issues. So I think in a in an early consulting career, you're I think able to move around more in terms of different parts of the practice and work on different projects, work with different partners, which is, I think, a benefit. I think as you progress, you're trying to become a partner or a leader, and so then you are focused, and you need to start focusing on a particular area, particular subject that you can then start to develop your own book of business. So hopefully that answered your question with Eris. I lost you. Let me get you on my screen again. Sorry.
Yes, it did. And if just a quick follow-up, you said you were tech, correct, more on the healthcare tech side.
Mm-hmm.
And do you feel that being able to focus in that would, for instance, in my case, if I was able to do that, um, allow for a strong transition into a more biotech center focus? If there's like, because it seems like I know you went over the consulting has broad skills, but by just being able to focus in that area, if there's any, I guess, core skills to that specifically, if that makes sense.
Yeah, I think there are. I mean, I think there are, you know, depending upon the space, there's always a certain set of vendors that kind of serve that particular space, whether it's hospitals or biotech or community health centers. Um, so I think there's some knowledge that may not be as transferable, but the various skills around understanding technology and maybe how to evaluate technology and select technology, which are projects that we've done in IT strategy. Those skills, the type of work that you do, that is transferable to to other sectors. So I think that you know depending upon, I think you want to be strategic in about the move you make and finding if it's a domain maybe where you're not as familiar with, finding that particular skill you have, like maybe it's technology, and finding a path that way, I think is a good potential strategy.
All right, thank you. That makes a lot of sense. Thank you. I appreciate it.
Well, Darius, you just want to come over for dinner? We should just keep on talking. This is
Yeah, I
definitely
got time. Thank you.
a fireside chat for you and I. But yeah, no, thank you for asking. They're all great questions.
Second. But that question actually just brought me to another question that might be something that folks are wondering. How do you network with folks that are in the consulting industry? What might you suggest that our folks do to kind of just, as you said, talk to people, etc.? What platforms? Is it a LinkedIn? Is it alumni? What are your suggestions?
Yeah, I mean, I think depending upon where you are in your career will drive some of that, Suzanne. For me, I probably is more, an alumni network, the various firms I've worked at. I think the importance of networking shouldn't be understated. And that, networking is a term that I used to shy away from. I think it's, developing, maintaining, initiating, developing, maintaining relationships. Networking to me, I think to my detriment, I avoided it. I saw it as a chore. And I think that was because I didn't approach it the right way. I think I was viewing it as more transactional, and that was my fault. So I do think if you're approaching networking as just forming genuine relationships with people that you have no idea where they may go, short term, long term. I think if you're coming at it from a genuine place, I think that's the best way to approach it. So for me, it's an alumni, more alumni, making sure I'm staying connected to folks at other firms, as well as if they moved on. A lot of times consultants will start to work, they call it like within industry, and they'll go work for a hospital and could be a future client. So that's obviously important. For someone earlier in their career, I think LinkedIn is a great avenue, and asking folks that that are consultants to obviously get some of their time, but then also to ask them to introduce you to someone. I think a warm kind of referral is always the best type. So.
And also, you've been in, as I mentioned, a number of consulting capacities before. What would your recommendation be for folks just entering the field? Would it be to aim toward larger companies or smaller, more boutique companies? What were your experiences in both, and what would your recommendations be?
Mm-hmm. Yeah, I'll give the typical consulting answer. I think it depends. I think it does depend. I think if you have, part of it is where you think you are in terms of wanting to focus on a particular area. I think that should be a key driver. Like if you are, if you want to be in healthcare, or if you want to be in a particular aspect of healthcare, one that is interesting, I think you should, that should open up opportunities at maybe larger firms, at a particular practice or service within that firm, if there is one, or a smaller firm. I think both of those are good options. I think if you're looking to get broader exposure just to consulting in general, maybe work in different industries and get exposure to that more broadly, I think a larger firm makes more sense. So I think one shouldn't close themselves off to either or. I think that's the first thing that comes to mind is how, and I think it's okay to not know a particular area of focus, and that you just might be interested in consulting in general, and kind of picking up skills and learning about it, and that you may want to do something more broadly.
And great answer. And that brings us exactly to 7 o'clock on the dot. And I just want to say thank you so much for your time tonight. this information was invaluable. So anybody out there interested in consulting the structured thinking, please just look it up. I mean, if you haven't taken business classes and you haven't seen some of those tools, these are things that you can gain information about yourselves, and it's really important. And also, these are just skills you can use daily, no matter what you're doing. If you're a consultant or not, you can use these as well. So again, Dave, thank you for your time, and we just appreciate you coming and sharing your expertise. And thank you to everybody joining us tonight as well. And again, reach out to some consultants, y'all. Use LinkedIn, and or you can go to our career networks as well. So again, thank you, and everybody have a great evening.
Thanks, Suzanne. Appreciate it. I enjoyed it.
Thank
Thanks,
you.
everybody.